welcome back to Restore Thrive. We are talking about knees today, and specifically knees that hurt when you're walking around. Now, if you're having any sort of pain or discomfort, I know nobody likes to talk about pain, but it's very common, not normal, on the outside of your knee when you're going upstairs or when you're putting weight through this leg and letting your knee bend over your foot, it's likely that something's not moving well on the outside of your knee. Now, you've got a couple structures out here. Now, the ones we can actually influence are minimal when it comes to what we can do with our hands as physical therapists or people who are trying to treat themselves. But we're going to show you one of our favorites today that we give our patients who have a problem with that knee bend when they're going upstairs or when they're walking. This is what we call a half-kneeling knee mobilization. So what I'm going to do, if I have problems on my left side on the outside of my knee, I'm going to kneel on my right knee. I'm going to start with my knee right over my ankle, and then I'm going to position my hands in two places. I'm going to put my thumbs right behind the back of my calf, and then I'm going to wrap my fingers around the front of my shin. Now, anytime my knee starts to bend or move over my foot, what's happening with my lower leg is that it's not only moving forward, it also has a little bit of rotation. So if we're thinking about the lower leg as it's moving forward, it's not just tilting forward, it's moving forward and it's spinning, which means the inside of your knee is moving backwards while the outside of your knee is moving forward. So you can see my hands, as I'm letting my knee come forward, are trying to just gently twist my lower leg in a little bit. Now, what I'm not doing as I do this, if we're looking down the line here, is I'm not letting my knee collapse inside my foot. I do not want to see your knee go over here inside of your foot. That's going to put some abnormal stress in your knee, and what we're after is, again, stretching that outside of the knee. Now, we know to create some stretch in the joint, we're not just talking about stretching muscles, we're also talking about stretching connective tissue and non-contractile tissue like your meniscus and the fibrous attachments of your meniscus to the bones in your tibia and in your femur. It takes about 2 to 3 minutes for that type of stretch to occur. So you can just work in and out of this position for 2 to 3 minutes. If that starts to wear you out, you can simply hold at end range for up to about 40 seconds, come off slightly, and then come back in. But make sure you're accumulating at least 2 minutes, if not 3 minutes. So this is our half-kneeling knee mobilization to deal with pain on the outside of your knee. If you guys have any more questions or need more help with your knee, you can leave a comment below or find us at restorethrive.com.